Welcome to the CytoCore soft tissue biopsy system in service. During this video, I'm going to walk you through the setup of the device and provide a few tips and tricks for clinical use. It is best to have a sales representative present to support your first 1 to 3 cases to ensure proper use and exceptional outcomes associated with CytoCore. If you need to be put in touch with your local sales representative, please contact Praxis Medical at the email provided. To begin, you'll need to collect one CytoCore device and one syringe from the CytoCore box. Box contents include 5 CytoCore biopsy instruments, each containing 3 Lear adapters within the sterile pouch, 5 5ml syringes, and 5 IFU booklets. We encourage you to review the IFU and follow the instructions provided. Fine needles and additional syringes are not included, so be sure to grab these when you are setting up the sterile table. When selecting which needle to use for biopsy, it is important to consider gauge, length, and specimen preparation. CytoCore is compatible with 25 to 22 gauge needles. We recommend using whatever standard beveled edge needle you would use for a routine FNA. It is best to use needles of appropriate length for the depth of the lesion. 1.5-inch needles work best in superficial lesions. Longer needles can be used with a coaxial introducer for deeper lesions. A 25 gauge needle will provide samples with ample cellular material and minimal blood dilution. These specimens are optimal for thyroids and other biopsies where slide preparation and on-site adequacy assessment is being performed. A 22 gauge needle will provide even more cellular material than a 25 gauge, but with a slightly increased degree of blood dilution. These specimens are optimal for lymph nodes, head, neck, and CT-guided biopsies, where more material may be required and the specimen is dispensed into liquid preservatives such as Cytolite. Now it's time to set up the device. First, remove the orange battery tab from the device. Next, press down on the blue arm to test the motor. Next, attach the syringe tightly into the syringe fitting and drop the plunger handle into the slot at the back end of the device. Then, you'll want to attach one Lear adapter to the fitting at the front of the device, and then attach your needle of choice to the Lear adapter fitting. 3 adapters are included with each device so that they can be replaced should additional passes be necessary. They simply act as an additional collection hub for more cellular material, and the translucent color helps to visualize the sample as it is being collected. If you know you will be taking more than one pass, you can attach the Lear adapters to the needles in advance for procedural efficiency. Now it's time to preset the suction. The black plunger can be adjusted anywhere from 0 to 2 cc's based on the composition of the lesion you will biopsy and how much suction you want to achieve. For standard solid lesions, we recommend 1.5 cc's of suction. This is achieved by presetting the suction at 0.5 so that when you press down on the arm, it will go all the way back to 2 cc's of suction. If you wanted to use no suction at all, you would pre-position the plunger at 2 cc's so when you enter the lesion to take the biopsy, no suction will be applied. Now the device is ready to be used. After routine prep of the patient, use imaging guidance to direct the needle to the desired biopsy site. Once in position, press back on the blue arm to initiate suction, and then fully compress on the arm to start the motor. Continue holding down the motor and immediately begin moving the needle in and out within the lesion, fanning throughout the entire lesion when possible to obtain a representative sample. Once you see material fill the needle hub and Lear adapter, or after approximately 10 seconds, you can release the pressure to stop the motor and aspiration. You'll feel the arm snap back and the needle can then be removed from the patient. Now that you have your specimen, you'll want to move quickly to dispense in order to minimize the risk of clotting. The most popular way to dispense the sample is by detaching both the needle and Lear adapter from the device. It helps to pinch the blue gear on the device to easily twist off the Lear adapter and needle. You will then attach these to the extra syringe available on the sterile table. This method ensures the device remains sterile and uncontaminated and also allows for easy handling by the individual responsible for preparing the specimens. The material can then be dispensed onto slides, into liquid preservative, a Firma, or even divided between these. If you know you'll be splitting the sample between 2 or more containers, it might be best to increase dwell time to 12 to 15 seconds to ensure ample material is collected. At the end of the procedure, if any material is visualized in the syringe of the device, remove it and dispense the material into liquid preservative for processing. Since this material will likely have clotted, it is best not to put it directly on the slides, as clot can obscure visualization. The device can then be disposed of. A few key things to remember. Ensure all components are securely attached and suction is preset before each biopsy pass. Use a needle of appropriate length for the depth of the lesion. Move the needle in the in and out motion the entire time during biopsy. Quickly dispense the sample to avoid clotting. Ensure your first 1 to 3 cases are supported by a sales representative to ensure optimal outcomes.